morning. My name is Richard Wexler, and this is Caring in America, the podcast for caregivers and care recipients. And as I do on every episode, who am I? Why am I doing this? So go back about 19 years. I'm minding my own business in the software industry, married later. My wife has a business out of the home. We have two children, young children, 11 and 7. And then in the summer of '05, our phone starts ringing, and it rings 4 times. And it's each one of our parents, all 4, who are now significantly ill and need our help and care. Were we ready for this? Of course not. We were the average American couple with all these things going on in our life between kids and homework and sports and everything they were doing and working and all of that and travel. Then all of a sudden we're on to a new adventure. And that adventure of taking care of them lasted 14 years until the last parent passed away in 2019 at 96. So if you go back about 16, 17 years, realized I could barely spell the word care, left what I was doing, started my company Points of Life with the idea I needed to really learn all about this, which I did, and then started educating people around the country about what it means to age and what it means to need care. And then a little less than a year ago, started our podcast, wanting to be able to reach out to even more people. And as we've talked about on previous episodes, even going to a bigger step now, trying to put together a national education program about aging and care. We have a really good episode today. We have a special guest. I'm about to introduce her, and then we will hear from her in a few minutes. So Annie Wagner is a social work graduate from Weber State University. She's been practicing social work for over 30 years and has done so in 4 states. For the past 20 years, her focus has been on serving the elderly and disabled population. She has worked in various settings from long-term and skilled care to home health and hospice. She's been a facilitator for an Alzheimer's support group, and most recently working to coordinate care for those receiving services through Utah's Medicare aging waiver. Annie also started Senior Care Coordination of Northern Utah to assist families with difficult decisions regarding care for their family members requiring some form of long-term care. She retired at the end of September 2023 and moved her elderly mother into her home to be her full-time caregiver. Annie enjoyed 4 months together with her mother before her mother's passing in January. Annie, are you there?
I am here. Good morning.
Good morning. Welcome to our podcast.
Thank you for inviting me.
You're very welcome. So I have kind of a general question for you to kind of help the audience. I mean, I think in this podcast and maybe just out in life, people hear the term social worker. What is a medical social worker?
A medical social worker is one that focuses on ensuring that the medical needs, the health care needs of their client has been met. We are able to access resources from all over the place to make sure that the people's needs are met.
Are you and have you been, I know you're not currently doing it, but have you been working with individuals, as I talked about in your bio, with a long-term care need?
Absolutely. That was my primary focus, was helping find resources and educating clients and their families on how to navigate this whole getting older, needing help thing. It can be pretty daunting.
Yeah, that's a word that I've used and I hear used a lot. Navigate. I mean, and here I go. I'm 5 minutes into this podcast and I'm already bringing up the four-letter dirty word that people hate, and that's called plan. And I don't want to. Yeah, and I don't want to put. She laughs. Words in your mouth, but I've been telling people. You can tell me if you agree or disagree that this when you're taking care of someone in this process, it'll never be easy.
No.
But what I've found, if you do put together a plan, if you talk about this throughout the family, I have found personally and also working with folks, it can be easier. Would you agree with that or not?
100%, absolutely. If you go in this without a plan, without ever having a discussion, you don't have a roadmap. You're really going in blind. And I don't know that you can ever foresee all of the needs or challenges. But if you don't plan, you won't see any of them, and you can get blindsided so easily.
Well, what I've seen in working with clients and what I've seen with all the people that I work with that work with clients, most people tend to react when there's a crisis. They tend to
Hmm.
react
Yeah,
when mom's flat on her back, having slipped on the ice and broken her hip, or dad's had the stroke, or something's going on. I mean, is that, again, I don't want to put words in your mouth, but is that something you've seen throughout your career?
absolutely. Nobody wants to talk about getting older and needing help. I think we're built for being as independent as possible, and we take great pride in not in being self-sufficient and not needing help.
Yeah,
So we don't want to talk about it.
yeah.
And it's avoided until you can't. And that's very unfortunate, um, because it's nice to be able to slip into that conversation with loved ones, and I think it can build stronger bonds with those loved ones, and kind of come to an understanding and a trust that I think is so vital in 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 continuing to meet the needs of the people that you care about.
And I totally agree. And I know you've done a lot of work in the Medicaid area, and most people are having to pay for care coming out of their wallet, coming out of a long term care insurance policy, something like that. And what I've talked about a lot through our episodes is the cost. And one of the things and one of the problems of not planning when mom's flat on her back. So let's look through a scenario. Mom's 80 years old. She falls in northern Utah in on the ice. She breaks a hip. She goes into the hospital. She goes through surgery. Hopefully she comes out okay on the other side through the anesthesia and everything else.
Mhm.
The recommendation is she needs to go off to skilled nursing. She's going to be there about a month. And this is probably, you've seen this probably a million times. She's, she needs to learn to move from her wheelchair to her walker to be able to get discharged from the facility. And then the question is, okay, well, where's she going next? And then, oh, there's a cost. how is this going to work? And you laugh. And how is this family or mom on her own going to pay for it? Is that something that you've experienced throughout your career?
Absolutely. And, I've always I prefer to have a lot of choices in my own life, and I think the more you plan and think about the eventuality of getting older and needing help, the more choices you have. Now, there are choices. I was very grateful that my mother listened to me and got long term care insurance well before she needed it. Uh, but I've seen people that are in the situation you describe, and so mom is just in the rehab center working really hard. She wants to go home, but she still needs help. So what do you do? There are some options. If she has financial resources, uh, you can pay for that privately, and can that can be quite a bit. It's here in Utah. It's about $30 an hour for an attendant or an aide to come in and help. So that's a possibility. If she just needs short term, just something every day, somebody come in, help her get out of bed, help her get dressed, that kind of thing. Um, if she needs more than that and that can't be in her home or needs 24-hour supervision, the most expensive thing that you can do is hire somebody to come into the home. That is the most expensive way to do it. Second option is assisted living. And that's a great option, but that's at least $4,500 a month. And then if they require additional assistance, like my mother was functionally blind, so she needed assistance with with making sure things matched, finding mail, reading the mail, those kinds of things. And so that increased the cost. So hers was like 7,000 a month. And then the third option would be long-term care, which some people called nursing homes, but now it's long-term care, and those can be like 10,000 a month. And that eats through the pocketbook really fast. Eventually, people needing that level of care end up on Medicaid if they live long enough. And so those are really the options, or moving in with family members. That's another great option. However, um, it it can interfere with family relationships, extended family relationships. It can interfere with relationships with the parent, and because the dynamic shifts. You're no longer the daughter; you're the caregiver. You're kind of the roles are reversed. That's that's tricky, and it's difficult to negotiate, but it's an option.
And I mean, just listening to you, this is something you've probably experienced throughout your career. And one thing you brought up is 24-hour care, something I've seen a lot, and maybe you've experienced, where this mom we were talking about, 80 years old, the kids have moved away from the home in
Hmm.
Utah. They live elsewhere in the country. Maybe they even live out of the US.
Yeah,
And so mom goes spends that month or so in rehab, skilled nursing. Let's say she goes back home, there's a very good likelihood for a period of time, which could be another month, could be 6 months, she may need that care 24 hours a day just to be able to function.
yeah.
And as you're talking about, I've talked about a lot, an average dollar amount nationwide is about $38 an hour. It sounds like it's around 30 in Utah.
Hmm.
That's a lot of money on a 24-hour
Hmm.
basis because the kids don't live near mom. Go
Right.
ahead.
It is. It's outrageous. And maybe mom doesn't need somebody hands-on 24 hours a day, but she needs somebody there to supervise and to ensure her safety.
Yeah.
In my mother's case, she had dementia, and she oftentimes didn't know where she was, wanted to go home, and I had alarms on the doors just to make sure that if in the middle of the night she decided she was going to go home, um, I would know. I could hear the door open and be able to respond. But it's difficult to do that, and you can't hire. Well, you can hire somebody to be there, but like you said, it's very expensive.
And I'm not sure if this is even something I've talked about on some of these episodes, but bringing up a personal story about, back in 2016, we were doing some work on our home, and I was given the assignment of cleaning out the attic above the second story of the home. And of course, I chose to do it when no one was there on a Tuesday morning about 8 o'clock. And I was up there about 10 feet on a ladder and had an argument with the ladder and wound up falling those 10 feet. I tried to use my wings, but they didn't work. And so, emergency surgery. And then after that, off to skilled nursing. I was there about 10 days. So I'm 62, 63 when this is going on. And then back home. And from yeah, it's not the same as a hip, but it's close. I broke a femur.
Mm,
It took me almost 8 months to get back to really good fighting shape. How are you going to you're on a walker, which they taught me to use in skill, but how are you going to get a meal? How are you going to cook a meal?
right.
How are you going to get yourself to and from the restroom? How are you going to get yourself in and out of bed? You're in a position you've never been in before. So when I talk about this, folks, I talk about it from personal experience and what it was like over those almost 8 months before I got back to the point that I was before I climbed that ladder, which I'm not allowed to do anymore. So, it's getting ahead of this. I mean, there has to have been a lot of challenges that you encountered over all these years of doing this.
Absolutely. And, you know, it, I think the frustrating part is that everything seems to be so compartmentalized in service provision. We don't always know what the other agencies and companies are doing and where the services are available. And we I don't know why we tend to be so protective of what we do. I think that everybody should be aware of. That's so vital. And I think that my biggest challenges were trying to think out of the box and develop resources because some things weren't there. And kind of turning over the rocks and finding things that and that's so hard to do when you're trying to provide care for a loved one. You don't have the time or the energy to do that. And that's where planning comes ahead. I think for probably the very most important thing, if as you're moving forward, is to have at least one telephone number of somebody when you hit this bump, some phone number of an agency that you can call to ask for help. And there are agencies in every county in the United States that can help pro- broker services for people in need of care. And I think that that's a vital phone number. Plug it in. Your area agency on aging is usually provided through the county somehow. County Human Services, social services through your county. Look it up. Plug it into your phone and just get that thing on speed dial. So as soon as you need it, you can call them. I think that's important. I have a question for you, Richard. When you fell off that ladder, when you got in that argument with the ladder, how long did it take you in order to get some help?
I don't want to go through all the gory details, but where I was climbing was probably 15, 20 feet from my office. I always have my cell phone in my pocket, but of course, that morning I didn't. It was sitting on my desk.
Mm-hmm.
And again, without going through all the details, it literally took me. I'm flat on my back. I'm flat on top of the ladder. I'm thinking my wife's going to kill me because I've probably ripped up the hardwood floor, which was underneath the ladder. It
Oh,
took me an hour and a half to go, a quarter of an inch by a quarter of an inch on my back to get the 20 feet to my office to get my phone
oh,
and call my wife. So, folks, you never know what's going to happen. I was a healthy individual and so on and so forth. And then all of a sudden, I'm flat on my back and taking me an hour and a half to go 20 feet. It, 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 it does change everything. And I thank you for that question. And I want to go back to something you said. One of the things we're trying to do with this national education program is two things. A, provide that phone number you're talking about so
mm-hmm.
people always have a website, a phone number where they can get that help. But something I've seen over the almost 20 years I've been in this industry, and see if you concur, and I think you kind of said it. I tell people, look at that hill up there. Pretend there's a hill. And on that hill, you see nothing but silos, like grain silos. And each one of those silos are different pieces of the senior care industry. We need to blow up those silos and make it where you can, as you're talking about, where you can find all the services you need in one location, not having to go from silo to silo to silo. It's too difficult.
It is.
One thing I want to make sure we do, we got about 5 minutes or so left. I want to talk about your mom, your mother. And I've been in that situation where we had our parents move in with us. Can you, if you're okay with that, can you talk about that a little bit?
Yeah. I when my mother was this summer, my mother was in a rehab center. She had fallen and fractured a tibia, and she continued to fall while she was in the rehab center because of the strong, independent nature, and also because she'd keep forgetting that she couldn't really walk. Um, she would fall, and they were not allowed to put devices on the chairs to inform them that she was trying to get up. So my sister and I decided that the best thing would be for her to come and live with me. And so I brought her in. I wasn't sure that I was going to be able to do it because we're so different, um, but we arranged the house and made it as safe as possible. And it was a great experience for the most part. It was probably the hardest thing that I've ever done.
Yeah.
It was challenging, and I felt like, boy, I've got this. I know what to do. I've helped hundreds of people in the same situation, so I thought I planned for everything. Um, but you can't plan for everything. Things come up.
Yeah.
Um,
Yeah.
One of the things that was frustrating for me and difficult was my mom oftentimes didn't know who I was,
Wow.
and the nature of dementia can sometimes produce paranoia, and so she wasn't entirely sure who I was or that I didn't have some ulterior motives. And one day it was exceptionally difficult, and I had to call my sister and ask her to come over. My mother, for some reason, always knew who my sister was. Don't know why, but I had to call my sister and ask her to come over and help my mother understand that I was really her daughter. And it was physically exhausting, emotionally exhausting, and and it's hard to do, especially if you don't have if you can't tag team it with somebody. It makes it tricky. But I would never replace that time I spent with my mom. It was
Yeah.
important.
No, I feel in a very similar vein. I mean, it's unbelievably challenging. I mean, for us, it was nice to have, them in the home
Hmm.
instead of driving to their home 40 miles away. There's a lot of positives. There are also some negatives, and I appreciate you telling that story, and our listeners understanding. You've talked about it, I've talked about it a lot. I mean, you can bring someone in the home, you can take someone to some beautiful assisted livings, or then it's up to family. And that's,
Yeah.
again, all of this is where that plan word comes in. And as you said, I've said this a lot. Once you kind of get into a situation like this with a loved one, you kind of both wind up on a roller coaster as their care changes, and she laughs. You don't know where that car's going when
Hmm.
you're following their car up, down, sideways, in between, because their health can change daily, weekly, monthly.
Yeah.
And then you, as that caregiver, are following along, probably holding on very tightly to the sides of that car to make sure, with some of the twists and turns that you're going through, you don't fall out.
Absolutely. Absolutely. Um, and it's important to have a support network, to help you hang on to that car.
Yeah.
And you're in a constant state of adaptation. You can't. It's hard to foresee. Once you're in on that roller coaster, you can't see what's ahead of you. You just have to continually adapt to the situation right now. And there were so many things that we I would do, and I'd buy and do things to help with it for that situation. And by the time I had that stuff in place, the situation had changed
Yep.
again.
That ro-
So it's tricky.
that roller coaster just keep, and you're glad it's moving. I mean, you
Yes.
don't want the other part where it finally stops. At some
Yes.
point it will, but
Hmm.
it is, I mean, physically, emotionally, financially, it is a huge challenge. And it's not something that we went through grammar school or high school or college and were taught, look, at some point in your life you're going to be taking care of mom or dad, and this is what you need to get ready for. Maybe that's a good idea. Maybe we should have that education
Yeah.
younger in life, because, and I've said this a million times, I mean, aging's a good thing. We're still with us, we're still breathing,
Hmm.
but it can be extremely challenging.
It can. And I've heard people say, "Well, I've had 5 kids. I can do this." Yeah, it's not the same as uh, caring for an aged parent is not anywhere near like caring for a 2-year-old. A 2-year-old, you can say, "I've had it." Go put them in their bed, put them in a timeout, and give yourself 5 minutes. Well, mom and dad aren't going to go with a timeout.
Yeah.
It's the they're not going to respond that well, and they have a lifetime of doing things their way. And now all of a sudden, they have to do it your way, or compromise with you on how to do it. And that's tricky. So plan and talk and discuss. It's so important to have those discussions.
Thank you, ma'am. I mean, folks, it's golden advice. And you're going to hear it over and over from me, our guests. I mean, plan, 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 plan.
Yeah.
It's going to happen at some point. I talk about statistics bear out that 95% of us are going to need some level of care, a few hours to a few years, something in between. So at some point, it's going to happen. And most likely, one of the first calls when something happens to mom, dad, your really close uncle, your really close aunt, phone calls, like in our case, are coming to you. And you need to understand, okay, we've talked about this. What are we going to do? Mom understands, dad understands their options. Hopefully, they still understand. Hopefully, their mental faculties are still there. It's so much more difficult when you haven't talked about this and now you're making decisions for your loved ones because they can't understand. So, I plead with you folks, we're going to keep on talking about this more in episodes. We're going to talk about this more in our national education project. I'm going to ask Annie a couple questions, and I want to give you some further information before we wrap up. I know you're retired, and this is up to you. Do you want to give out any information, phone number, website where people can connect with you?
Absolutely. Yeah, I'm passionate about helping people get through this stage of their life. It it's for me, it's like I'm in the lifeboat and I've got life preservers that I can hand out. But if they don't contact me or they don't cry for help, I don't know where they are and I can't do it. But I'm more than willing. So yes, my email is D.A. Wagner, Wagner dot 55 at gmail.com.
Folks, as we started this national project, I keep asking for your help. What would be helpful for you? What would be helpful for your loved ones? I'm about to give you an email. Email me with those suggestions. We're at the beginning point of putting this all together, the beginning point of our messaging that we want to get out to millions across the country, and we need your input. So please email me at eldered2023 at gmail.com. eldered2023 at gmail.com. Give me your ideas. Give me your suggestions, please. So, first of all, I want to thank Annie. This has been a fantastic conversation. We're here to help you. I'm hoping some of this information does exactly that. And as I say on every episode, folks, until we talk again, have yourself an awesome day.